Now, Ghana has procured 500,000 PCR test kits for COVID-19, according to the head of Virology Department at Noguchi Memorial Institute for Medical Research, Professor William Ampofo. When the inputs arrive, the backlog of cases will be cleared and the nation can test up to 15,000 samples in a week. Recently, it emerged that the nation was facing difficulty in procuring reagents for testing, so a backlog of 7,000 samples had built up and all testing facilities apart from the Noguchi had closed down. Speaking this morning at the Information Ministry's press briefing, Professor Ampofo said the situation will soon change.
The first activity we set out to do was to strengthen the current PCR testing capacity in Ghana. PCR, as you know, is a polymerase chain reaction. This is the direct detection of the virus that is associated with COVID-19 by a molecular method. So what we did was we identified facilities that had these PCR machines. You've heard about them, my institute, Noguchi, ACCR in Kumasi. We also have the CSR in Accra. We have the Public Health Reference Lab in Accra. We have the Veterinary Services Director that has 3 testing centers throughout Accra, Laboni, Itakradi, Pong Tamale. We also have Public Health Lab in Tamale. We have the Konfanoche Teaching Hospital that also has a PCR lab. And so all these facilities have come together to form the lab testing network with PCR for Ghana. What we've done is that we have provided training, we have strengthened the ability to conduct testing, and these have been kind of strategic. So we've covered the southern part of Ghana, we've covered the middle part of Ghana, covered the northern part of Ghana. So the plan is to ensure each region has PCR testing going forward. And I'm glad to report that we are on track with this, because to ensure continuous testing, the plan was to ensure that there was sufficient laboratory supply to go along with providing surveillance support and also for case management, that is clinical cases. And you've just heard from Tabuaji details of the surveillance and also the case management effort. Of course, all this data is because the lab has been able to confirm the suspected cases and also provide the backup for the management of patients. So we did come up with a bulk procurement scheme to provide sufficient resources to up to 300,000 tests. This scheme was developed in conjunction with the Ghana Health Service and the Ministry of Health, with support from the Ministry of Finance. And we were strategic enough to go direct to the source, to China, where most of the laboratory equipment and supplies could be competitively sourced. So the Ministry of Foreign Affairs, through its China, has worked on behalf of the people of Ghana to source this equipment at a competitive price and to purchase it in bulk. So I'm glad to report that the first shipment arrived on Saturday with the flight that, using the strategy of the flight that brought back the returnees. So we did get a significant quantity of laptops on Saturday. Another flight arrives today, so we will get more supplies. And finally, the rest of the bulk shipment is scheduled to arrive in Addis Ababa tomorrow, making arrangements with Ethiopian Airlines to fly this into as soon as possible. So you can see that we actually have I can just give you some of the figures. We have about 150,000 swabs, sample collection medium. We have over 100,000 KN95 masks. We have over 700,000 nitrile exhalation gloves. We have 260,000 autoclave bags. We have PCR tests to do 500,000 tests. We also have microcentrifuge tubes, we have cryo vials, we are buying new PCR machines, and we're also buying what we call glove boxes that will enable us to do some work in some of the labs. So we've put together a comprehensive program which has been funded by the Ministry of Finance to support the labs to provide PCR testing.